Hello, Dr. Miaken of Monarch Family Chiropractic. Welcome to our spinal workshop on today's topic, which we're talking about spinal hygiene, specifically looking at being a fit mom. And with this topic, we're covering information around your pelvic floor health. So this is really women who are preparing to conceive, so prenatal, pregnancy, postpartum, and beyond. And frankly, when we get into the material, you'll start to see that this is more than just for women who've had children. Because when we look at the pelvic floor and our deep lower core, we'll see that it impacts every body. And so while I think this is a vital topic for moms to be, moms with multiples, I think it will be seen as something that's vital for everybody. So let's jump in. And before we do, just want to thank you for being here today, for investing in your time and your energy to really gain some better understanding about how you can choose to support a healthier body. Because what we do today is supporting our health and the trajectory that we're on for the next 10, 20, 30 years. So we do these workshops because they hold us accountable to being and doing what is most right for ourselves. And our hope is that it's supporting and doing that for you too. Okay, so let's talk about the importance of the deep system of support. It's your lower deep core, and it includes the pelvic floor. Okay, now I'm going to just jump to the next slide because I want you to see what we're talking about here. So we're looking at a lateral view of a person. You can see the spine here. The spinous are right back here. So when you feel the bones right down the middle of the back, that's what you're feeling. Up here is your diaphragm, and down here is your pelvic floor. And then the deepest abdominal muscles you have are your transverse abdominis, okay? So that's what makes up your deep lower core. And your pelvic floor is a really important part of this. Now, we are looking into the pelvic bowl here, okay? So you can see the, lower lumbar spine. This is vagina, here's anus. So you're looking at the muscles that make up the bottom portion of, our pelvis, our bottom. And this is really vital. To be most efficient and most effective in our stability, we need to have a healthy base so that our outer system, which connects to that base, can move in a healthy, strong way. That includes our arms, our legs, and our head. So when we have a strong base, we can move freely. And the pelvic floor is most important component of posture because it is the anchor or the bottom of everything. And so when we look at, when we go back to this picture, we need to have a healthy pelvic floor. That way our diaphragm sits on top and our head sits on top up here. So we are stacked properly. It's really about a healthy foundation. Okay. So let's erase that. Okay. So let's go back to this. So we have to understand what the deep lower core is, of which makes up the pelvic floor. We have the diaphragm on top, the pelvic floor on the bottom. The transverse abdominis is wrapping around. And then we've got our multifidi muscle, which is the small, deep stabilizing muscles of the back. Now, during pregnancy, your lower core supports the growing baby and helps manage increased pressure. You have to understand your uterus literally goes from here to, I don't even think my camera has enough space here. It goes from being this big to being this big, right? And we're carrying a growing baby that puts intense pressure and stress on the bottom half of our body, but also the upper half. So we can impact breathing challenges. We can experience digestive challenges and stress. We can experience, urinary challenges there because it's putting pressure on all those systems. And we want to look at supporting post-child birth. How can we support recovery and continence? Okay. So pelvic floor, what does it do? It supports the abdominal contents, so all the guts. It's supporting the skeletal system, that stability of our posture. It allows for the passage of waste. So again, because it's holding our guts, it allows for everything to pass through to the end of our digestive system. It allows for the passage of babies. It's a big component of healthy sexual function, posture, and connecting the core to the lower body and the upper body. Now, there's symptoms of dysfunction in our pelvic floor. You can see urinary incontinence, meaning if you increase the internal pressure of your body, you actually leak urine. So when you sneeze, you cough, you laugh, you increase that pressure, you aren't able to hold your urine in. You can also have a difficulty during childbirth, sexual dysfunction, postural dysfunction, and then bowel issues like constipation or difficulty controlling gas. So there's multiple symptoms that could indicate there's stress to your pelvic floor. And this conversation is really a catalyst for understanding what's the health of your pelvic floor and how can you help support that deep lower core in addition to the pelvic floor. Okay, so why does your pelvic floor health matter during and after pregnancy? Strong pelvic muscles help support the baby and prevent incontinence during pregnancy. Okay, healthy pelvic floor muscles can reduce the risk of tearing during childbirth, and postpartum, they aid in recovery and prevent long-term dysfunction. So again, if we think about this and the amount of pressure that's placed on this bottom portion here is, usually our uterus is this big. Look at how big it gets, okay? And it's pushing into the diaphragm and lungs, pushing into the stomach, pushing into the bladder here, and the colon, which is right back here. So it's just, there's a lot more stress on this system. And again, you'll see women who have multiple children, their abdominal strength compared to the first one and the second, third, and fourth, there may be a big difference there. If not appropriately, supported and recovered post-pregnancy. Now, I just want to talk about something called diastasis recti, which is the separation of abdominal muscles along the midline. Okay, so we're talking about, I'm going to step back so you can see this deep lower system, which is, here's your diaphragm. You got your transverse abdominis that wraps around. You've got your deep low back muscles, and then your pelvic floor, okay, which is the lower portion here. Okay. Diastasis recti is actually when you have separation of your abdominal muscles along here because there's so much pressure, not just downward, but outward. And it's very common during and after pregnancy. And about 60% of women experience diastasis recti during pregnancy. And 33% of women still have it 12 months postpartum. And again, when you look at, what does the abdominal wall do? It helps support instability, helps with breath and breathing, helps with movement. And so if you've got pelvic floor dysfunction, in addition to separation of your abdominal muscles, then that just contributes to a weak core muscle overall, which reduces the entire support system of your pelvic floor, increases your risk of dysfunction, and impacts your posture. Okay, it can contribute to incontinence, lower back pain, pelvic instability, and I would even go further in impacting breath work, instability of your rib cage, and cause some pain in there. So risk factors for this is multiple pregnancies, large babies or excess weight gain, and weak core muscles prior to pregnancy. Okay, so we look on this left side, you can see a really healthy abdominal wall, You know, we see normal, I guess, spacing of the muscle. We look at a diastasis recti, we're seeing gaps here. Okay. And it doesn't, I mean, this doesn't necessarily happen all the way down, but you can have, typically they're measuring it in terms of fingers. So I have a 1 finger or 2 finger or 3 finger diastasis recti, and it can happen closer to the rib cage, closer to the pubic bone, or along the belly button. So that's all things that we can assess while somebody is going through pregnancy, and give some good support as far as what you can do to help support stability and help manage pain if it's supporting or creating some pain. And when you're working with your OBGYN or midwife or doula, sometimes they will talk about, depending on where that diastasis recti is, they might talk about different positioning during birth and labor, different breathing techniques that they'll focus and utilize. But it's really more about posture, to not put more stress on that split abdominal muscle, because the biggest thing is wanting to get support on recovery. That can heal. It just takes time, and it takes commitment and work. So strengthening your pelvic floor. Okay, I first want you to understand the mechanism of breathing. Okay, so when we're looking at this picture here, this is actually looking at, here's your diaphragm right here. I'll label it as a D. And this is the breathing muscle. And as the diaphragm contracts, it actually expands into the lower portion of the body to allow for the rib cage to expand this way. Okay, so you get lung expansion, and the diaphragm movement goes downward as it contracts. Okay, now I want you to think about, when we're breathing, it should be a 360-degree breath. Okay, so we're going to practice this. But I just first want you to put your hand on your chest and your belly, and I want you to take a deep breath in. Just in through your nose, out through your mouth. Do it again. And out through your mouth. Now, as you were taking those breaths in and feeling where the raise was, did you note that your chest was doing more motion with your hand, or your belly? Okay, a lot of us do a chest breathing. So we're breathing from here as opposed to deeper into our belly and doing abdominal breathing. I find that people who have trained in singing, they have practiced doing abdominal breath. They think about a balloon expanding into your stomach as you breathe in. Chest breathing is more of a stress breathing. And we don't get as much oxygen and air when we breathe in through our chest versus our belly. Okay, so I want you to, we're gonna practice 360 breathing, but I want you to do it in parts. So we're going to do this again. So I want you to put your hand on your chest and your belly, and I want you to breathe in, and I want your chest and belly from the front to expand symmetrically. So the same. So as you breathe in through your nose, out through your mouth. I want you to focus on allowing that chest and that belly breath to breathe and expand at the same time. Okay. So they're breathing and expanding at the same time. Okay. And this may take practice. Next, what I want you to do, let's see. Next, what I want you to do is I want you to put your hands along your side of your rib cage. Okay. And I want you to think about taking a breath in again. And as you're feeling that breath, I want you to feel, do you feel expansion happening equally along the rib cage? right to left. Or do you feel restriction on one side versus the other? Okay, so again, you're going to be around that bra strap area where you're really assessing, how am I breathing right to left? So not only are you breathing symmetrically here, you're breathing symmetrically here. Okay, then this is where it becomes a 360 because we've covered the front, we've covered the side. Now we're going to go to our back. Okay, so we're going to go to about our bra line, and we're going to put our hands on our back, and we're going to take a breath in. And feel right to left. Do we have equal expansion into our back? And this may be an exercise where you start to practice a 360 breath of symmetry, expansion in the front, the sides, and the back, all at one time. Now, one thing that you can do is you can use a scarf. Okay. Let's see if I can get a better view here. You can use a scarf, and you can tie it around your neck. I mean, tight enough so you can feel your breath, but it doesn't need to be too tight. But as you're breathing, you can start to feel your rib cage and your back. Breathe in, and your scarf gives your brain some sensory input to start understanding, am I getting a symmetrical 360-degree breath? Because when you're doing that, that means that you're using your breath in a healthy way. Okay, you're not just focused on breathing up here, you're using your entire pelvic. We're going to add in the pelvic floor breath here in a second, but you're using your breath as it should be, okay, in full expansion. Think about an umbrella, breathing down into that deep lower core to engage and get the oxygen that you need. So you may just need to stop here and just practice your 360 breath until you're tuned into all of those motions. And as you're breathing, and if you feel or experience restriction, use the scarf and use your brain body connection and movement. Perhaps it's the rib cage. Perhaps you are noticing your right side doesn't move quite like your left side. So that may be where you lay on your left side. You put your hand over your head to stretch it out, and then you breathe into that right side to start getting motion into the rib cage. Okay, so there's things that you can do, but I think there's a component of just getting connected to your brain and body for that 360 breath. Now, I want to get into strengthening your pelvic floor through breathing, utilizing that 360 breath, but now getting some connection to the lower pelvic floor. Now, we are looking at a picture of the muscles of the female pelvic floor, and we are taking a picture looking underneath. Okay, so you can see your, here's your hip bones right here. Here's your coccyx, so your tailbone, and your sits bone. Okay, and then you can see where your anus and your vagina are. Okay. So all of these muscles oftentimes are not getting the engagement, or we don't quite understand the importance of engaging these muscles in a healthy way that will support stability. I know we're told, oh, do Kegels, but Kegels is oftentimes it's think about stopping your pee midstream. Okay, that's just one portion of your pelvic floor. There's much more that happens in terms of the pelvic floor as far as what it can do motion wise and stability wise. So that's where I want to go next. Okay, is I want to teach you how to breathe in and engage your pelvic floor. And that is called a zip and lift, okay, or a close and lift. So I want you to think about zipping your tailbone forward, okay? So if this is your sacrum here, okay, so you got your ilium here, your sacrum's here, and here's the front of your pelvis. You're gonna think about zipping your pelvic or your tailbone forward. So the nodding tailbone forward towards the pubic bone, okay? Now, I want you to be aware that I'm not talking about a pelvic tilt. We're actually pelvic tilting, okay? That's very different because that's an abdominal motion. This is coming from the inside out. So when you are doing this, you're not going to see any outward motion, okay? It's all from the inside out. So, so you're zipping that tailbone forward towards the pubic bone. So think about that tailbone is nodding towards the pubic bone, the front of the pelvis. And you're going to lift from the inside. So you're going to close that gap and lift your vagina upward. So you can think about stopping the stream of pee from the front, stopping like a poop or a fart from the back. So again, you're getting this entire, let me see if I can draw here. So here's your tailbone. So you're zipping it forward, and then you're lifting from both the front and the back upwards. Maybe you think about your vagina as an elevator. It's moving up towards your rib cage, or lifting a blueberry up, okay? Or sucking up through a straw from your urethra, so where your pee comes out and your vagina, okay? So again, it's not a pelvic tilt. There should be no outward movement, okay? And this is really connecting to your lower half of your body. And you're first connecting it with your 360-degree breath. Okay, so what you're going to do is we're going to do this together, but we're going to practice a zip and lift. So what you do is you inhale through your nose, do that 360 breath. And then as you exhale, you're going to make a shh sound and you're going to zip and lift. So I want you to think about a J breath. Okay, so let me see if I can get, so your breath is coming J up, okay? So as you're nodding that tailbone towards the pubic bone, you're thinking about breathing in and lifting like an elevator or grasping a blueberry, okay? So in through your nose and then out through your mouth. And then as you inhale, go ahead and relax. Okay. And again, if you're seated, you're going to keep your sits bones straight. Okay. They're not tilting back and forth, but deep breath in. And then you're going to zip and lift. Like a blueberry's pulling up, like you're lifting a blueberry, or your vagina is going into an elevator and you're going to pull up. You're going to feel it up towards your rib cage. And then you're going to let it go with your exhale. Okay. So let's do it again. So you're going to take a deep breath in, that 360 breath. And then as you exhale through your mouth, think about a J breath. You're going to come in and lift. Okay. So you're thinking about coming in. Let's see if we can get a good picture. You're coming in and lifting up from the bottom of your pelvic floor. Okay. So breath in. So that tailbone nods forward, you pull it in, keep your sits bone neutral, and then you lift up, grab that blueberry. And I've done those a couple times. I've been practicing this, frankly, because I am pregnant. So I want to make sure I have healthy, strong pelvic floor, and healthy abdominal muscles for labor and delivery, but also post pregnancy. So I'll be in my best place to continue to practice this. But as you're doing this, you should start to notice some engagement from the bottom of your pelvis. It's not just a Kegel where you're just stopping that pee midstream. It's the whole bottom of the pelvis. Okay. So I would look at, let's go back to this picture. So if we're just looking at, what makes up the entire pelvic floor here, you've got muscles on the right side that are stabilizing on the front and the back, and they're all attachments are happening on this tailbone or this coccyx. Now, the pelvis is a mobile joint. You've got your ilium that are made up of 3 separate bones, your sacrum in the back, and your tailbone. And it wraps around to the front, and you got your pubic bone. So those bones motion and move, and they move with our breath, and they move depending on what's going on with the pelvic floor. You can have instability or weakness on one side compared to the other. Okay. So that's where if you're just doing Kegels alone, where you're just stopping the pee stream, that can be and cause more challenges and issues because you may be, reinforcing this weakened, unstable pelvic floor. So that's where we want to take the whole picture and see how you can engage all of the musculature, dropping, again, I guess I go back to nodding the tailbone forward, breathing in or exhaling in as you lift everything up, coming from the inside, and engaging the entire pelvic floor as opposed to just a portion of that. So when I use Kegels in this presentation, I'm thinking about the entire pelvic floor, not just one portion of that pelvic floor. And frankly, if you don't address the pelvic floor and start to engage and do activities and start to exercise, but you have a faulty pelvic floor, which is, again, the base to the outer system, right? This is what's creating stability. If you have a strong base, you can build on that foundation to help support healthier overall structure and strength. If you have a faulty pelvic floor and you don't address this, then you're really exercising on a faulty foundation. So this really needs to be addressed first and foremost, as you get back into activity. So I would say the biggest thing is practicing your zip and lift. Okay, go through this this breathing exercise. And I would start with this 360 breath. Make sure you've got good symmetry with your breathing. And then you can add layers to that where you're starting to breathe and engage your pelvic floor. Once you feel comfortable there, then you can start coupling the zip and lift with movements. But you don't have to do the zip and lift seated. You could do it standing, you could do it seated, you could do it on all fours, you can do it on your back in a bridge position like this top position here. The biggest thing again is, I would say, is not a pelvic tilt. So you're not rocking your pelvis forward. It's all from the inside. So there shouldn't be any motion or movement that we see on the outside. And you can add, once you get comfortable and you understand, okay, I've got controlled breathing, I've got controlled contraction, it's a 360 breath, then you can start doing things like adding a bridge pose as you're doing that breath. You can do it seated as you're doing single arm lifts, okay, or leg lifts, or you can do it like a bird dog or a cross crawl, as you see in this lower in this picture here. We call this a cross crawl or a bird dog, or you can couple it with a cat cow. But again, your ischial or your sits bones should not be moving. So you want to make sure those stay neutral as you're dropping this pelvis, your abdomen down and rounding out your back. It's not changing this because we're not trying to do pelvic tilts here. We're trying to engage the lower portion of, well, I guess I would say your deep lower core. Okay. And this all happens in steps, right? It doesn't happen all at once. So I hope you're getting that from me. Now, tips for maintaining a pelvic floor health. Want to make sure you stay hydrated, avoid constipation. So that means you got to think about how you're feeding yourself. Are you getting enough fiber? Are you getting enough good, healthy, nutritious foods, not just eating processed foods. I mean, I think this is an obvious, but if we're having to strain on a weakened pelvic floor, that's going to cause more stress. Maintain good posture when sitting and standing. Practice your zip and lift. You can do it anywhere, seated, on the floor, standing. And you want to gradually start to return to exercise postpartum. I would avoid high impact movements first. And I would say, I think that a pelvic floor physical therapist or women's health physical therapist would be a great healthcare professional to seek out following birth, to just have an understanding of what's the health of your pelvic floor. Are there, in addition to what we've talked about, are there things that you need specifically for your pelvic floor or your abdominal muscles, if there is a diastasis recti, that can help support your healing and recovery? And of course, I would say, making sure you're maintaining your chiropractic care. Chiropractic is helping both with your structure and your ability to be resilient and more adaptive to anything that you're doing. We help align the pelvis. We reduce tension on the pelvic floor muscles, can have enhanced nerve function, supporting the muscle control. And gentle adjustments can help relieve pain and improve mobility. And it really does complement pelvic floor recovery for your best, for your overall best recovery. I think, going through the massive changes that your body does when you are pregnant, not just hormonally, but physically and structurally. Recovery wise, you need to look at how is my body going to be supported coming back, both from deficiency of nutrients, because you just built an entire human, and then just coming back to your body so that you can have a good foundation for the rest of your life. These are references and resources. We always like the ICPA. There are really great articles talking about support for prenatal pregnancy and postpartum wellness. If you have diastasis recti, I came across this Tupler method, I think, that looks really available and I think supportive in terms of doing it on your own or going in and actually doing some weekend work. There are some great, I think, pelvic floor specialists who have got some good online resources for recovery or support during pregnancy. This is one that I've personally used, this Chelsea method. And then I think it's about supporting, how can we find a good pelvic floor specialist? If you want to come on into the office, we're happy to provide you with some recommendations that we've either personally used or we have, patients within the practice who have used some really great pelvic floor specialists. And then there's some good podcasts out there. One I came across is this Between Two Lips, Kim Vapni, if you want to have more resources and information. But I do think this is really a vital conversation for women's health overall, and just health as we age and take care of ourselves post children. So if you have any questions, please let me know. Let Dr. Kristen know in the office. We appreciate you. We are grateful that you are a part of our practice and you choose to be accountable to your health and well-being and choose the steps that it takes to be healthier as you age, right? Age is, it's a number. You don't have to be your chronological age. You can be a biological age that's actually healthier and more vitalistic. and younger than your chronological age. And so the things you do now are setting you up for success for what's to come. So Dr. Miaken Ziegler, Monarch Family Chiropractic, thank you for being here today. Bring your questions if you have them, and we look forward to connecting in the office.